Hey Spartan, Dr. Nick here from HealthSource. We're talking this week about your condition of the week, which we're going to talk about arthritis. Especially people over the age of 50, this is a very common thing. And one of the biggest things that we look at and we talk about is what can we do to prevent it or stop it from getting worse. So I got this chart behind me here. We're going to use it to help you understand what really arthritis is. Because I ask patients all the time when they're sitting in an exam room across the table from me and I say, tell me about what's going on. They say, well, I have arthritis. My favorite question, I like to kind of poke and prod a little bit in this situation. I say, what is that? You know, what does that mean? And a lot of times patients really struggle with understanding and just explaining what arthritis really is. And they don't have a full understanding of what it does, what it causes, why it hurts, why it's sore, and what they can do to help themselves. So I want to talk first about the actual condition of arthritis. I'm going to pull this off the wall here and kind of point out a few things as we talk about the neck and the lower back, because it's really important to understand what truly arthritis is. So when we look at this, we're going to talk about this picture right here first. This is what your neck should look like. It should have this nice C-shaped curve that you see in the green here. That's a healthy neck. That helps us distribute our weight, helps us have really good mobility and motion. It allows us to function like we're supposed to. The next phase here, this is the first phase of arthritis. This is kind of the warning sign usually. People struggle with pain, irritation, etc. In this stage. This is the straightening of your spine. That's the first thing that we see. The disc spaces still in here look really, really good. You know, we don't see any huge problems with that necessarily, but the alignment is much straighter than the curve that you see here. Now the next phase, this is phase 2. This is what happens when we start to see this disc space start to narrow out. You see some extra bone growth out on the front of the spine. That's really truly what arthritis is. It's when the bony structure starts to change. It's when that ability of your body to recover and heal is changed and altered. And then if we look at the last phase here on the far side here, we see that it's basically happening everywhere. It's at all different levels. We're seeing disc spaces narrowed. We're seeing that arthritis at all different stages. So it looks the exact same when we talk about the low back. The curve is there. The disc spaces look good. We lose the curve in the second place. Third place, we start to see the disc deteriorate. We start to see that extra bone growth. And then we start to see that happening at all stages over here in the complete arthritis. So, you know, this process that we're talking about, guys, is not something that happens overnight. This takes months to years to happen, but in order to understand arthritis, you have to understand this process. And that's one of the big things that we try to educate on is how do we help you stop it where it is and not let it get worse. So if you have questions, as always, reach out to us. We'd be happy to answer any questions you have.